So easy to say, I'm fine. I go to work every day. I know my people around me. Yes, but you might be targeted by someone who's nowhere near you and is exploiting that level of comfort you might have in your physical surroundings.
Welcome to another episode of the Physician Growth Accelerator, a show where we break down your private medical practice systems into vitals, diagnose root cause of what may be restricting your growth, and prescribe what to do about it. I'm your host, Ed Williamson, and I believe that everything you experience all the time, anywhere, is the perfect outcome of your current system. So if you're not happy with the results that you're getting today, then all we have to do is tweak the system. And you're familiar with the show, you know we talk about the health of the business side of your private medical practice. And part of staying healthy is protecting ourselves from attack. And that's why I'm excited about our guest today, Aaron Painter. He is the CEO of NameTag, the world's first identity verification platform. He spent his career at the intersection of technology and business, and he has some really interesting things to talk to us today about identity. Aaron, thank you so much for joining us today.
Oh, Zed, thanks. I'm a big fan of the show. Even though I'm not a practicing physician, I still take a lot of lessons out of your content. So thank you for having me.
Appreciate it. Absolutely. And this is I'm really interested in our topic today because people that we work with, clients of ours, clients that we've worked with for years, they are starting to feel exactly what you're talking about, and that is that these practices are starting to become under cyber attack.
Yeah, I think it's something that's happening everywhere, unfortunately, and we're seeing it especially in healthcare and healthcare related fields. It's literally, I think we were talking about before, something that kind of keeps me up at night. And it's been one of these areas where we've seen the warnings, going back to even, I think, September-ish of last calendar year. Almost every month, it's been Department of Health and Human Services, FBI, Homeland Security. I mean, one after another saying, we see particularly active cybersecurity risks, people targeting healthcare and often targeting healthcare help desks and larger organizations, or in a smaller practice, that might be the person who's answering the phone, literally targeting that person as the way to try and take over access to someone's account or to obtain sort of sensitive personal medical information.
Yeah. It's interesting. I think there's probably a correlation of human behavior here that may be existing in our audience mind. It's kind of like a patient. A patient starts to deal with something. They know maybe what they're dealing with isn't the greatest thing ever, but they kind of put it off because they think, well, I'm invincible. It's not going to be a big deal. And then something bad happens and they go, oh man, I should have gone to the doctor. Are you seeing that kind of same thing from the private medical practice where, well, that happens to other people. It's probably not going to be me.
Yeah, I see security is that way, and it is a lot like medicine, and that it's easy to assume it's not going to happen to you. Oh, well, that was my neighbor happened. Oh, I'm not going to get sick. I have a great immune system. Or, oh no, I don't click on those kinds of things. Like I'm not going to have a cyber issue to worry about. But what's one of the biggest changes that I've learned to realize, in particularly in the world of cybersecurity, that might be a little bit different than the world of medicine, or certainly than the world of physical security, is that in a sense of physical security, local community really matters. In some communities, you might leave a door unlocked or the gate unhinged, or you certainly might know the threats. In the intelligence gathering world, we think, well, we get to know people and we know when there's, sort of a risk that might be coming to a certain community. You kind of trust what's happening locally. You have a sense of what behaviors and patterns are like, and you can sense things that are abnormal. Who's that person walking down the street? Why is that car parked there? Things like that. In the world of cybersecurity, what's different is that there's not a local community. It's that you have really every local community having access to another. And so you can have someone who is crafty, hardworking, well-trained, sit on the completely other side of the planet in a very different, maybe local community, but target you and your community. And that is a wildly different threat matrix or threat paradigm than we think about when we think about our world of physical safety or physical security. And that's why cyber, it's so easy to say, I'm fine. I go to work every day. I know my people around me. Yes, but you might be targeted by someone who's nowhere near you and is exploiting that level of comfort you might have in your physical surroundings.
Yeah, I love that last statement, exploiting that level of comfort. That comfort, you know, makes you feel secure, and it's the exact opposite, right? That level of comfort is now something somebody else can exploit. What would you say is, let's say, the most surprising thing that people who are, let's say, in medical practices, what shocks them the most about what's out there, what's possible, what kind of things are happening from a cyber attack?
Yeah, a lot of times in cyber attacks, cybersecurity, we think it's complex technology. Yeah, someone's going to break an encryption, and we think of the movies and these really advanced, cyber hackers doing advanced things. There is an element of that in what happens in the digital world, but that's actually not the risks that we're seeing most prevalent today. And this is where identity sort of comes into the equation. And by many accounts, 90% of cyber attacks today are identity related, which means it's not doing some, breaking cryptography and advanced computational process that you're finding a way to do something malicious. You're actually pretending to be or impersonating someone who has access to something. Typically, in practical sense, that means think of your account, think of a login you might have for any number of the systems that might be critical to your business or to protect patient data, or even sometimes just in your life. That credential or that login, typically an email or a username and a password, is incredibly valuable because it's sort of the gatekeeper to sell everything that lives behind it. If you're a social media influencer, your login to Instagram might be particularly valuable to you, right? If
Right.
you're a physician, your access to your medical record system might be particularly valuable to you, or other things. And so that credential or that login is where people target. And while it might seem simple to you, it's incredibly high value to others. So one of the common techniques that most people advise, the government advise, I would certainly advise, everyone recommends is today you need things like multi-factor authentication on top of a username and login to systems that you might rely on today and that protect important things. Multi-factor authentication, funny enough, comes in a few different flavors. Some of them are better than others. One of them is receiving a text message. Let's say I got a text message with a code and I kind of type that in. That is base level. That is okay, but that is not great. And the reason it's not great is that it relies on the telcos, the mobile telcos, at being very good at knowing who someone is.
Yeah.
And so that means if you call today your mobile telco, your favorite one, and say, "Hi, guess what? I got a new iPhone. Can you please move my phone number over to this new iPhone?" That telco operator doesn't necessarily know who you are. They just know that you're able to access that account. And so they ask you maybe simple security questions or other things. And in many attacks, especially sophisticated attacks, bad actors will do that first. They'll call and they'll basically take control of your phone number. So that when someone says, "Oh, I'm going to send you a two-factor code to your text," well, unfortunately, that might not be a secure method. So the
Mm.
next best way is when you have things called an authenticator app. And you probably have one of these on your phone today. It's a third-party app you download from a variety of providers. Microsoft makes one, Google makes one, others make one. And it gives you kind of a revolving code. That revolving code is an additional layer of what they call multi-factor authentication that sits on top of things like your email and your password. So when you go to log in, it asks you email, password, and that token from that revolving code that you have. That is a really critical kind of first step that I'm MFA junkie. When I get together with friends, I literally say, "Great, hey, let's add MFA to some of your accounts." Like it's something I actively do. I live with it. Any single account that will let me add MFA and let me add an authenticator app in my life and in my work, I have one. It is a critical, necessary, but not sufficient first step.
Yeah. Oh, that's really good advice. When, because unfortunately, I would imagine that there's still a lot of people out there that, has password as their password spelled with two fives, or, it's just people get overwhelmed with having to have a password for this and this and this, and maybe they use the same password everywhere. And the idea of multifactorial, now they're going, oh man, this is such a headache, when really it's not, right? We over overestimate how much issue that is, but the power that you're giving someone else out there, when you're not doing these things, is a lot. And I don't think we should ever really do that on purpose. And by having those weak passwords, we're doing it on purpose. We are saying, hey, I'm going to make us easier. It's kind of like going back to the physical safety. If you are in a neighborhood and you are the house with no fence, no locks, no lights, no dog, you know, well, someone's going to go to your house first.
And the code to the garage on the post-it on the door. Like it's literally that level of simplicity that we're often seeing. And there's additional reasons, right? Particularly in this world where we operate with protected medical information, and HIPAA and other guidelines, we all need to be responsible and take proactive steps to keep that information safe. And so things like MFA are kind of baseline. Like you really need to consider that. The challenge and what's happened and gotten wild, particularly in the last 12 months, is that people are doing this type of attack that again is not technical. And what they are doing, we used to maybe call being kind of a con artist. The modern term for it is social engineering. And what happens is they call somewhere where you have an account and they pretend to be you. And they say, I am Dr. blah, 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 or I am a nurse, or I am picky, I am Zed, and I can't access this. I turned on multi-factor authentication. I was a good person. I did it. And now, for whatever reason, I can't access my account. That could be because you upgraded your phone, something went wrong, you somehow got locked out. This concept of getting locked out, surprisingly, is over 50% of the reason why people usually call for support or call a help desk. It happens a lot. And even if it didn't happen a lot, unfortunately, it is the vulnerability point. So a bad actor calls a company and says, hi, I'm Zed. I set up MFA, and I'm locked out of my account now. I can't access it. And unfortunately, that rep who, their help desk person, let's say they got into the business of trying to help people and do the right thing, they have very limited tools to assess, are you actually Zed that owns this account? Sometimes they ask you if you have security questions. Sometimes recently I did this over email. I emailed someone and said, hey, I'm locked out. And they literally said, well, I need to confirm your email address. Like I literally emailed you. You should know my email address, but they asked me to type in the email my email address. That was their security question. I mean,
Wow.
mind-boggling. But they have some method of saying, who are you? How do we verify who you are? And then from that, if they make a decision, they will, quote, reset access. They will unlock your account for you. And this is the vulnerability that everyone is exploiting because it's not a technical thing. It is purely social. It is purely calling and taking advantage of with the reset or the recovery flow for these higher security ways to log in with things like MFA. People are claiming that they are you and that they are locked out and they need their access reset. They get it reset, and the next thing they do is they log in as you and they take advantage of whatever credentials you have access to. Oftentimes it's maybe elevated permissions or sensitive things, and they either take that information and then try and go sell it, or they deposit things like ransomware inside your environment and then call you and say, hey, I've all of your data hostage. And they're doing it simply by this primitive method of pretending to be you and circumventing everything that's sort of technological about cyber element and security.
Wow. What does someone do about that?
It's really a hard area, and it's become a new area. Funny enough, this vulnerability has existed for a while, which is why I say multi-factor authentication is necessary, but it's not sufficient. Because if you haven't thought about what's the reset or the recovery process, let's say as a technology company or as a technology platform, you kind of created this vulnerability for your users. And so it came to fame sort of last August, and particularly this MGM, poor MGM, they didn't mean to become the target of this, but the entertainment and casino complex in Vegas, exactly this scenario. Bad actor called the IT help desk, said they're an MGM employee, they're locked out, the employee 8 minutes later reset access. Bad actor went in, deposited ransomware, and basically took down MGM for almost 2 weeks. And it was such a big thing that, 60 Minutes has now even done an episode on this. It's wonderful. And they break down what happened and how. But since then, since last August, we've been in an epidemic of these kinds of attacks. I mean, hundreds and hundreds of major companies are all being targeted exactly the same way, taking advantage of the same vulnerability. So the advice that some of the companies that provide this MFA technology have given is to really think about your method of verifying who someone is. The before maybe it was security questions. One more advanced way that, companies like Okta you might have heard of or others are recommending is this idea of doing a video verification, which means, hey, I'm a little suspicious, or this is an important thing we're doing. Let's jump on a video call, a Zoom call, a Teams call, and let me see who you are. Let me engage with you. Maybe I'm gonna ask you to hold up your government issued ID to see if you're rightfully the account owner, things like that. So the recommendation has been go to these more exhaustive measures. So many big companies, many big hospitals, many big insurers today are all adopting those kinds of practices where they say, if we have an employee who's locked out, increasingly too, maybe we have an end user who's locked out, we're going to go to a very comprehensive method of having sort of a video interview with that person, or we're going to tell them to come on site, to the IT or to the security desk, let's say at a
Yep.
hospital facility, and before we reset their access. That has become sort of the default standard. The downside with it is that it's very time consuming, it's frustrating, and if you're in a critical care situation, you don't have time for that sort of exhaustive, verification process, let alone maybe to, go across campus or to another area to do it in person.
So what other options are there? When it comes to this type of attack, are there other things that can be done to make it a safer place to handle this type of attack?
Yeah, one of the techniques that we found very effective kind of became the basis of sort of our company at least. And we were very early in this area and we kind of saw it as a problem before MGM. And we started working with some really big companies to solve it because they were worried about that kind of threat. So by the time MGM came along, we had developed a great solution here and we developed kind of a proven track record. And now one of our fastest growing areas is frankly healthcare because healthcare is so under attack with this. But it came from this idea that, there's a method of scanning your government issued ID, taking a picture of it, and taking a selfie photograph. And for a long time, that's been around. That technology is not new. Maybe you open a new bank account remotely, and the bank might ask you to do that, typically for anti-money laundering or know your customer regulations. But it's sort of always a mystery to me how that happens. But yet, when you call to transact with the bank, they don't rely on that anymore. They ask you these sort of security questions.
Yeah.
And so it led us to this invention of, hey, what if we took the same end user experience, take a picture of your ID and take a picture of your selfie, but instead of doing it in a web browser, doesn't matter if it's on a computer or a phone, in a web browser, which was the industry standard, and what if we did it only on a mobile phone? And it turned out by moving that same process to a mobile phone, we could make it wildly more secure. It's actually also faster, it's an easy experience, it's pretty slick, but it's wildly more secure because these modern mobile phones we have so many security features native or embedded in them that we could
Right.
use the same experience but do it on a mobile phone. And then if we did that, we could verify someone's identity in a secure way and then connect into those MFA systems so that somebody could self-service or a help desk agent could send a request to get true confirmation of knowing who the person is before things like that password or MFA are reset. So that became the basis of kind of our whole company and our product focus. And given how wild this is as an attack vector right now, we're really trying to help as many companies as we can as quickly as possible to sort of get those enriched methods in place. So that's been one kind of automated or technical approach that works for companies of all sizes, but it's in that same spirit of doing something more intense. And it's in the spirit of really trying to think about and understand the risk that exists when someone is locked out.
Yeah. That's interesting. It's funny. I've been traveling a lot recently, and most of the time at airports now, it feels very similar to what you're talking about. You pop your ID into the little scanner, you stand in front of the photo, it takes
Mhm.
the photo of your face, matches it to the ID. You don't even show your boarding pass anymore because they already know that information, right? And so it sounds like what you've done is you've taken something that is secure enough for the TSA and brought it in so that a business can use that to keep themselves safe. Am I off base with making that comparison?
No, you're actually exactly right. It's funny. I sat on a panel not too long ago with the makers of the hardware that the TSA used for that. And I said, hey, help me understand, how is this different than me using my mobile phone? Can I use exactly the same? Because the camera we have on our phones are in some ways, actually more sophisticated than even
Oh
those
yeah.
cameras that are taking your picture of the TSA. So we were able to compress all that big hardware and just use your modern mobile phone to do the same kind of thing, except that means you don't have to be in person. So you could have sort of a remote experience at the same, in some ways, actually a better level of fidelity than you're getting at that airport experience. And that opens up all these cool new use cases to do that experience for security purposes. You're exactly right.
Yeah. And so from someone in private practice thinking about their business, this feels like um, they may be unaware that they have someone impersonating an employee acting as if they are locked out into any kind of web-based system that they are participating in, which could be EMR, practice management systems, EHR, just a lot of tools that we're logging into, and they don't even know any of that's happening. The employee doesn't know, the business doesn't know. You just end up getting delivered the negative impact of what that might be. Like you said, ransomware potentially, or maybe selling your data to someone else? Am I missing any scenario?
No, you're spot on. There's another scenario that's gotten really hot, but one small detail. It's important to know that at the moment, for these bad actors, personal health information is the hot commodity. So on these places like called the dark web, where people go and buy and sell things they stole, there's that is the hot value today. Someone's social security number, someone's credit card number is not valuable anymore. It is way more valuable to say I have someone's, personal health information. And so that's why it is particularly under attack. People really want that because one, they can sell that information. Two, they can actually use that information in much more nefarious ways. I mean, we've seen how good things like ChatGPT and generative AI has been in letting us create, really well-written paragraphs or emails. Imagine if you could get an email or send an email to someone, if you're a bad actor, that says, hey, I know you're on day 7 of treatment for X, blah, blah. This is a really hard time. Hey, click here to join this new support group that I put together for this.
Geez,
Boom,
yeah.
click the link, bad things happen. Da, da, da. But wow, would that be a highly targeted email that simply having your health information would allow a bad actor to use? So the
Is that the main?
implication,
I'm curious,
but
bringing up
yeah,
the, why people want to buy that information. What is the use case that's out in the world of why people are after private health information?
this is a hypothesis area. It's what I've been unpacking with a few friends. It's a great question. I don't have a perfect answer to it, but one of my guesses is in that category.
Yeah.
Certainly holding, blackmail and ransom and other things, but the ability to use it for more advanced social engineering
Yep.
targeting of a given
Just
individual.
immediate, yep, immediate
Yeah,
influence over behavior.
it's like a data source that you can then use these easy tools now to go really target and get much more advanced as a bad actor. It's, hi, I'm calling from the hospital and blah 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 with your lab results. There's so many things you can do because you have that info. Couple it with some of these new tools. So the new tools that we need to
Mm.
talk about, and the other big sort of scenario to have in everyone's mind is around deep fakes. And this concept of deep fakes is really, really important because we live in a high trust society, and it's sort of ironic because thinking about deep fakes is so counterintuitive for people that practice every day with humans, right? Deep fake is the opposite of the human coming in and needing a medical visit or needing care,
Right.
and so it seems counterintuitive. But because we are so trusting, it's a critical tool to understand. So what is a deep fake? A deep fake is a term that started in 2017, 2018 on Reddit, where there was a person who started talking about this phenomena, and at the time, they were using modern AI technologies. They've since gotten better, but to create sort of adult content using celebrities, right? Mixing faces, mixing bodies, and making things that were inappropriate. And the concept sort of caught on, and the term sort of caught on. Today, the existence of the generative AI technology that we talk about in this podcast, that you read in other places, has made it such that it is very easy to impersonate the likeness of someone else. And that can be their voice, that can be their face in a photo, and that can be them in a video. To put this in perspective, even 5 years ago, if you wanted to recreate someone's voice, there would be a script that you would read of specific words, and it would take 20 minutes, and you would read the script with those words to a piece of software, and the software might learn how to recreate your voice. And today, Microsoft researchers have recreated that in 3 seconds with any voice clip, meaning a clip of someone, a voicemail, an Instagram post, a podcast, you name it. Somebody can create sort of a voice clip of that person. Obviously, the more time you have of that person, the better quality it gets. But that means that someone who's even calling your practice and speaking to reception might not necessarily be the person that they claim to be. And if it's a bad actor who's gotten hold of someone's PII or PHI, and then they call the practice and have the voice, oh, I know you. Hey, it's been a while, and you even recognize the voice, it might not be that person.
Right.
And the same concept is then going to these other scenarios where even when you're doing a video call or frankly even video treatment, it might be someone who is actually running a piece of software that is a real-time fake of them moving and speaking and looking like the person they're trying to impersonate. And so this is
Wow.
a real threat and a real set of technology advances that I think we all need to better understand.
Yeah, that's incredible. So for the business owning physician out there that has a private practice, um, Where should they go for more information? Can they learn more about NameTag, or what would you suggest they do as a first step?
Yeah, at first, I appreciate you listening. Hopefully you learned a couple new things at least. Like healthcare, the best thing is starting with awareness, right? When we understand our ailment and we understand what's happening, we can all be more cautious and take more proactive steps. So yeah, hopefully you've learned things. Please share these things with others because it's important that your colleagues and your fellow physicians and colleagues understand what the threats that are out there, so you can take the right steps. We love talking about the stuff. We research it, we follow it, we follow advances in it. I'd say we're most active on LinkedIn. So please feel free to reach out to me, follow me, follow NameTag. We produce a lot of content on this. We have some great white papers on our site talking specifically about healthcare and
Great.
understanding the threats and the guidance that's come from various government agencies and sort of other practical tips and things you can do. And please reach out. I love feedback. I love hearing from folks who listen to the podcast.
Excellent. I really appreciate it. We'll put a direct link to your LinkedIn in the show notes, and then also a link to your website in the show notes as well, for them to be able to track down those white papers. And also, listeners, visit physiciangrowthaccelerator.com. The reason you may want to do that is, again, we believe everything you experience is the perfect outcome of your current systems. If you're feeling constraint within your practice, the revenue is coming down, costs are going up, or you just know something is off, you can go to physiciangrowthaccelerator.com and check your vitals. A simple questionnaire, yes or no questions. It'll immediately give you some pointers of where to look within your practice so that you can remove that constraint. Aaron, thank you so much for joining us today. This is really a fascinating topic and important for us to all focus on. I really appreciate you.
Thanks for having me, Zed.
And we'll see you next time on the Physician Growth Accelerator.